everybody. Hope you all had a little bit of a break.
That hatch discussing the shutter, you want to keep it on? Are you good?
How's it look right?
Yep.
I think, summer, I'd rather keep it on.
No worries.
So, alright, we all good?
Yep.
Okay, with the completion of 2022, we've found that the number of lives lost on Queensland roads has been the worst in more than a decade. At 299 lives, there are a lot of Queenslanders today who are grieving for people who weren't there for Christmas and who will never be there ever again. So this is a source of real concern to us. There's a range of differences in terms of the lives lost compared to the year before. We see a very big increase in the number of motorcycle riders who have been lost, increase of nearly 30 in only 1 year. We're seeing a big increase in the number of people drink driving. And this is something the police service is seeing in their statistics as well, a big increase in the number of people who have been caught at random breath testing units, and we're seeing a big increase in people speeding as well. So we also are seeing, compared to last year, we had of course the floods in March, and we lost at least 12 people driving into floodwaters and not being able to get themselves out. So we're seeing some big changes, and after we saw the lowest year on record in terms of numbers of lives lost in 2019, the increase in fatalities in Queensland has correlated, of course, with the pandemic, and it actually got worse this year. So we're going to need a reset in terms of how people go about driving in Queensland, how we go about policy in Queensland for 2023, because we want 2023 to be a lot safer year on our roads. So what we'll be doing is calling a roundtable together of all our stakeholders in the last week of January to put everything on the table. We know there's a dual responsibility here, and let's be clear about this. There's a responsibility on every driver every time they drive to make safe choices. There's also a responsibility of government to be very aware and to respond from a policy point of view when things don't go the way we want them to go. What we've seen over time is a big reduction over the last 30 or 40 years as a trend in the number of fatalities on our roads because of policy interventions, whether that's seat belts, random breath testing, speed cameras, a whole lot of different things have come in over time that have seen the number of lives lost reduce. So we'll be talking to stakeholders and listening to stakeholders at the end of January. Once everyone's back from holidays and their leave, we want everybody on deck to be part of this conversation. Do you want me to hold with the overhead plane? Just bear with us a second. You pass them out. So we'll be wanting to work with stakeholders from right across the board, from road safety stakeholders to the police, to research groups like CARSQ, RACQ. We want to put everything on the table to see what we've got to do from a policy point of view to have a reset and make sure that safety becomes a much more prominent thing on our roads this year. We've seen the implementation of a whole range of measures such as our mobile phone and seatbelt cameras, increased fines for speeding, and a range of measures. But clearly this year that hasn't had the impact that we would like it to have. So we've got to be looking at 2023 with fresh eyes. Every Queenslander wants our roads to be safer. We want our roads to be safer. We want to come back here in a year's time and say we've had a much, much better year and a much safer year for Queenslanders. Any questions?
So before you get to the round table, this problem's been around for quite a while. What are your thoughts on what the key issue is? What can you do straight away?
Well, there's a range of issues that we clearly identified. Motorcycle riders, an increase of 29 deaths this year is a shocking statistic. So clearly motorcycle riding community is an area we've got to focus on about our communications there. We saw a huge increase actually of people buying motorcycles in that first year of the pandemic as people weren't able to travel. They made other choices about where to spend that discretionary money, and we saw a big increase in the number of people getting on a motorcycle. But unfortunately we're also seeing a big increase in the number of people who have lost their lives on a motorcycle. So that's a very specific thing. We'll be talking to the motorcycle community about that. We've also got to get that drink driving message across because we pandemic has been a really difficult time for a lot of people. What this is telling me is that some people are responding in not a very, functional way and making poor choices. We've also got to deal with seatbelts. This conversation in regional rural Queensland, the number of people who have lost their lives because they didn't wear a seatbelt is still, to me, absolutely shocking. We've brought in the cameras. We'll be bringing in more of those cameras across Queensland that identify when people don't wear a seatbelt and finding them and making sure they get the message. But there's a huge still disproportion of people not wearing seatbelts in rural regional communities, and therefore their numbers of fatalities is increased significantly compared to, say, in urban contexts.
The opposition is saying there's too much of a focus on revenue rather than road safety. What's your response to that?
The opposition are professional whingers and whiners. The reality is these seatbelt and mobile phone distraction cameras absolutely save lives every single day. We've had the courage to bring them in, and we've got a very strong record on road safety. The lowest year that we've had on record in 50 years was 2019 under this government. But a global pandemic has meant that the number of people losing their lives, not just here but in other states as well, is increased. And this is something all governments need to grapple with in terms of getting a reset so that people can focus on safety. And that's why we've got to work collaboratively with the experts in this field.
Whose job is it to fix this, and the federal government need to take more responsibility as a holistic problem across the nation?
Look, we welcome any interest from other levels of government in road safety, no doubt about that whatsoever. Most of the operational levers in terms of road safety are state governments, so that's a matter for us to be the primary leaders on. We accept it. I've always accepted that responsibility very seriously since I became the Minister for Main Roads in Queensland. We brought in a very wide range of measures. There's been some real successes around that, but the pandemic has been a new challenge. It's been a new challenge on putting a lot of stress and pressure on people in all kinds of different ways, and we're seeing some of that dysfunction play out on the roads. I've got no doubt about that, but we've got to work out how do we get people to refocus so they make safety every single time they get behind the wheel their number one priority. I read the fatality summaries the day after, and I can tell you right now, sadly, the majority of them are people who are making dangerous decisions, often multiple dangerous decisions at the same time. They might be drunk, speeding and no seatbelt. And every time you do something that increases your risk, especially if you do more than one, the chances of you having a crash where you're either killed or hospitalised are really high. And it's not just the fatalities. The fatalities are obviously the worst possible part of this issue, but there's also the hospitalisations where some people will never be the same again. These crashes sometimes maim people in a way they don't fully recover, and that's also a big worry as well.
So you spoke about motorcyclists, the increase in the rate of motorcyclists dying this year. Does there need to be more action taken, I guess, in the licensing process, getting people out of the roads on motorbikes? And have you seen, I guess, an increase during COVID of people dying for licences?
Yeah, look, we certainly have seen a big increase in the number of people during the pandemic buying motorcycles, especially when that period where people couldn't travel internationally. We saw a huge spike of not just motorcycles, boats, all sorts of goods. But what we've also then seen is an increase in fatalities as well. So we'll be working with the motorcycling community, and we'll be looking at all aspects. I'm open to the ideas of all stakeholders. We do have a lot of provisions around training, whether you get behind the wheel of a car or a motorcycle. You've got to do 100 hours to get your licence, and I think that's a really strong measure. I've done about 70 odd hours with my nephew, and I could see the value in that time spent behind the wheel with an experienced driver. But we're open to the feedback of people from right across the spectrum, across all aspects of road safety. We should be looking at all of it.
With the motorcycle licences, if you've got one 30 years ago and you maintain your car licence, you don't have to reapply for your motorcycle licence if you take it up 30 years later. We look at mandating refresher courses for people who start riding again.
Well, I'm loath to say we're going to, open up specific aspects, but I'll be certainly listening to the feedback of road safety specialists and those that have a stake in this. They will all have different, angles and perspectives on it. not one single thing that's put the road toll up. There's a whole range of different things. We've got to look at all of those, and we've got to get the numbers down, the number of crashes down on all fronts. That's what we've got to do, and I'm open to the feedback of road safety specialists.
Your department's still shadowed a big drug driving review this year. Will you be increasing penalties for drug drivers?
Well, as I said, everything will be on the table at the end of this month when we all come together from across the board. So, there's various measures you can place. You can get more punitive. You can have more educational. Let's have that conversation first. I don't want to preempt that conversation. I want to hear from all of those stakeholders about what they think and what they know have been part of this outcome, so that next year we can come back and say we've made a big improvement and our roads have been a lot safer.
You mentioned your own research shows that people who are involved in these fatalities are breaking one law, if not multiple laws. The penalties are already very strong. How do you legislate against people who are already willing to break the laws?
Well, that's what this conversation will be about. You need that combination of, appropriate penalties that discourage people from doing dangerous things. You need those educational things too, as well. So you've got to get that balance right. We spend millions on road safety campaigns every year. We target them. We look at different aspects of it that we think need attention. We'll be looking at that as well. But look, let's be really clear. Most people drive safely. Most people do the right thing, and I thank them for that. The majority of people are good drivers who look out for each other. The people who are doing dangerous things are people who are disconnected from other people on the roads and in our community. And we need to be able to get to those people to make sure that safety, that they have the respect for themselves, but they also have the respect for everybody else on the roads as well. That's where we need to go.
Are you happy with the level of road safety campaigns at the moment, and do you think there perhaps needs to be a rethink? Like we saw, in the 90s, the early 2000s, quite confronting TV commercials. Do you think things of that nature need to be brought back so it really hits home?
Yeah, look, I'd certainly be guided by road safety specialists on that. Road safety campaigns continually change. They need to stay fresh so that people engage and they listen to them. You can't just keep doing the same thing. Everyone zones out. So, I'm open to good ideas. Sometimes we've had to be shocking on our road safety campaigns, and that's something that we should consider. But we do spend millions on road safety campaigns. We've changed them over time. You'll see a lot more of that now on social media, for instance, and on your iPhone than you might necessarily in other areas, while we still do some traditional media. So we've changed that over time and targeted that into different age groups, different regions. We use all the tools of social media targeting in a way that we didn't 10 years ago. We've got to keep on that to make sure we're as effective as we can be.
Does the speed camera program need a bit of a rethink? I mean, we've got more cameras than we've ever had before, and it doesn't really seem to be having an effect on the road toll. Is there something you can do about the visibility of those, the locations they're in, things like that?
Look, as I said, we'll be looking at all aspects. I'll be keen from the feedback from all agencies at our round table. You've got to continue to stay ahead of the game when it comes to road safety. So all aspects should be considered, and I'm open to proposals from stakeholders on all areas. We do have random speed cameras in Queensland, and I'll be very clear. They mightn't be popular with people, but they're effective, and we need them. And other states have often got much lower levels of enforcement around speed, but speed's a killer. That extra 10 kilometres an hour, some people think that that's not a big issue. Well, when you've got to stop suddenly, that could be 40, 50, 60 metres difference between whether you're going to have a crash or whether you're not.
That's for the police.
Oh, sorry, Chris. Chris, I almost forgot.
Sorry. Did you want to say anything?
Yes, indeed.
Where are we up to in terms of, with our RBTs, for example? Are police conducting RBTs to the same level that they were pre-pandemic?
Yeah, so we're heading back towards those levels that we were pre-pandemic. What we are seeing that's concerning is the figures in terms of the general statistic for detections are fluctuating. So through some periods we're seeing increased amounts that are around that 1 in 50 drivers being detected either drink or drug driving, and other times that's returning to the levels around 1 to 100, which is around the general sort of across a jurisdiction average.
So could I just step forward a little bit? So can I ask you, from the police point of view, it's obviously frustrating the road toll. What do you see as the key issue?
Well, as the Minister's outlined, I commend the initiative for the roundtable. We need to be working with our partners across government, as well as also community representatives, those driver-rider representatives, heavy vehicle operators, as well as academics. For us, road safety is a 24/7 responsibility, but it's also... For us, road safety is a 24/7 responsibility, but for the wider community, it's also a 24/7 responsibility. So it is very frustrating from a policing perspective to see a smaller cohort of drivers that are willing to break those laws and to keep offending. But some of the programs we've got are having an impact. You know, we spoke about the speed camera program. We know in some instances where that is rolled out, like the point-to-point cameras, having an effect on road safety, reducing speeding in those areas as well. So, but what we're seeing, again, as I said, that small cohort that are willing to continue offending, will work very hard with our partners to where we have to apprehend and conduct enforcement activities.
What do you want the community to know, that when your officers and first responders turn up to these scenes, what does that do to your work?
That has a really massive impact on officers. Okay, what we're seeing in some cases is officers suffering post-traumatic injuries as a result of attending too many traffic crashes, has an impact on all of those emergency responders, and we obviously have our support networks through our peer support and our human services officers, which are psychologists. But that ongoing exposure, in particular where we see vulnerable people in society, we see young children, we see parents, brothers and sisters that are having their lives swept away from them, and we know one of the most frustrating parts is we know it's absolutely preventable. So that has a massive ongoing impact, but also to people that are in the health system, so the doctors and nurses that are in hospitals. So not only does it have a mental impact on them, but it has an ongoing impact on the economy as well.
Have you been in touch with your counterparts around the country? Is the spike in the road toll unique to Queensland, or is it something that's happening elsewhere?
No, it's not unique to Queensland. So what we're seeing is most jurisdictions are seeing an increase, and certainly New South Wales and Victoria have also seen an increase in, unfortunately, in lives lost.
In 2020, the Road Policing Command was amalgamated with the Community Support Command or Community Contact Command. Do police need a separate, dedicated Road Policing Command to focus on this issue?
Well, what we saw is the Road Policing and Regional Support Command remained and has a dedicated Chief Superintendent, which is my role within that. So I am solely dedicated towards road policing. I have a superintendent and the road task force. I still work with all of the districts. Those staff are still in place. Obviously, we're looking at growth where we can across those road policing networks. So there's been no loss of focus on road safety as a result of that. And as I said, it's my task to continue to work with the district officers and continue to look at deploying resources where we need to. And again, that's where the roundtable is great, because working with our academics and the Road Safety Data Bureau, some brilliant minds there based within transport and main roads, and we're looking at how we can improve the deployment of resources to have them in the right place at the right time.
What's your message to road users?
Look, again, we see that those fatal 5 contributing to accidents, so speeding, impaired driving, which is our drug and drink driving, wearing your seatbelts, fatigue and distraction, are all still contributing towards fatality accidents as well as serious injury accidents. We see those serious injury accidents that cause life-altering injury. So in some cases, people have ongoing medical care for the rest of their lives. So the message is, when you're getting behind the wheel, you are responsible for yourself, you're responsible for your passengers, and you're responsible to other road users as well. So it's quite simple. And again, the message around drink driving: if you're planning to drink, don't drive. If you're going to drive, don't drink. But those simple things that you can do, that simple responsibility which you can take on, can have a massive effect on you arriving safely at your destination.
Thank you.
That's very much.
Yeah.
Just on,
Thanks, Chris.
just get your thoughts on the voluntary assisted dying availability now to Queenslanders.
Yeah, look, from yesterday, of course, voluntary assisted dying is now available for Queenslanders who are terminally ill and in terrible pain, so that they can have a choice about how they may wish to end their days. I think this is a very compassionate reform that brought in by the Palaszczuk government. It's one that's been requested from the community for many, many years. I'm relieved that for some people this will make a big difference to that last phase of their lives. I think it's the compassionate thing to do, and I'm very proud of our government and those that voted for this legislation, that they voted to help people in terribly difficult circumstances.
Should people have concerns?
Well, I don't think people should have concerns whatsoever. It's a voluntary scheme. If people don't believe in voluntary assisted dying, of course, that's their prerogative and their right. And this is only for people who are terminally ill, who wish to exercise. And what we found in Victoria, for instance, is that half the people that applied successfully for it, in the end, didn't actually use it. Now, what that tells me is that for some people, they want to have that choice, they want to have it available if things get too terrible for them, but not everybody gets to that point. But it's a relief and for people to have that there if they think they need it. And I think that's a good thing, and I've had a lot of positive feedback on this from people who think that choice should be someone's human right, and in Queensland it is.
Has there been any applications yet? If so, how many?
Well, it only become operational from yesterday, so we don't have any statistics, of course, at this early stage. There's about 15 months of preparation, a lot of behind-the-scenes operational things that needed to happen to set the whole scheme up. As you can imagine, there's very strong safeguards around it. There's some very specific measures that need to be carefully controlled. That work has been done. I thank all of our Queensland Health staff and everyone in all the agencies for doing that work. But we found in Victoria, which was the first state, the scheme has been going very well. We will closely monitor the scheme to make sure it's achieving the purposes that we want it to. That is something we've been committed to from the day the legislation was passed through the state parliament, and we'll see how it goes. And I've got no doubt the Health Minister will be able to give people updates after a certain period of time has gone by.
How long before you think we'll see a successful application?
Look, I'm not certain about that. The Line Minister will have a better idea of the time frames there, but obviously you need to have a process that's fair, that makes sure people have their response in a reasonable amount of time. But there are measures there. You have to be terminally ill. You have to be in incredible pain, and in other states it's worked very well. We'll be making sure Queensland works well too. Good. All right. Thanks everybody. Cool. Thank you.